Okay, well, thank you very much. It's my privilege now just to give an overview of the ICVBM, the Indiana Center for Vascular Biology and Medicine. As we are in our evolution at this point in time, and as Marion very correctly said, none of that would have really happened at all without the early support that he and you all have had with this visionary approach to fund a center that we had in our mind, but really hadn't gotten fully established. And you really have established it. Your philanthropy has enabled many supportive things to occur that in turn have resulted in us being able to leverage that funding to many different other kinds of granting opportunities. And so we've built something a lot bigger than that alone would support, which is, again, really based on your foundation. So I want to start with thanking you again for that wisdom and that knowledge that allowed you to work with us in that regard. We do think that we're involved in changing the course of vascular disease. And you're going to hear throughout the day from several presenters who will explain how that works and why I think that we can say that. Can we turn the lights down a little bit? That might be a good idea. And we're going to talk about some of the continuing progress as well as the future plans. One thing I do notice with the computer hookup I have today is it's a little bit slow in terms of slide transitions, so mostly for the sake of the speakers who are in the audience, you just might click your button before you're actually ready. This vision statement has been the same since we established the center in the time frame of early 2000, which was to become the leading vascular biology and medicine facility, translating leading-edge research into novel therapeutics and diagnostics for patient care. We recognized at that time that there were many places that did basic research, and there were many places that did clinical research, but it was relatively unusual in the cardiovascular realm to find a center that really intentionally, purposefully worked to move the one into the other in a very consistent way, and that certainly is what we've been trying to establish as a process. And this is also an older slide. Some of these that I'm showing, many of you have seen before, but because I realize this is a much larger audience than usual, I'm showing them again so everyone has an opportunity to be reminded of that if you haven't seen these before. As we think about how to achieve this vision, we believe generally that it always begins with good people. We need to have the right people, and we need to recruit the right individuals across a range of disciplines. The center, by its design, is an interdisciplinary endeavor. What that means is that we have a lot of different specialties, a lot of different team members, both at the technical level, the doctor level, the trainee level, so many different levels, working from so many different parts of the medical center. And that is really what gives us a great deal of strength to move things forward, because often people from different perspectives see important different things, and that can lead to inventions and creations and ideas and things like that. And so this is key, to work with different key individuals, and what I'm describing is this sort of good interactions between those individuals. Critical to the whole thing is the team. I'm reminded to say that none of what I'm able to present to you today is something that I've done, really. It's been done by a tremendous group of people who I've had the privilege to work with over the last several years. And again, you're just going to be meeting a very few of those today, because the numbers are, in the dozens and dozens. You can only see a few of them at one time here. But I really have to emphasize the critical nature of that teamwork. Good research ideas then emerge from these interactions, and we try to create then opportunities from those ideas for good funding of a variety of kinds. Federal, non-federal, that supplements then what you have as a foundation, literally foundationally funded. And I'll show you one way relatively recently in which we've been able to do that with some on-campus funding as well. And then with sufficient funding, we then can lead to the seeding, if you will, of pilot projects, infrastructure, and then translating that into clinical research and outcomes. This is a very important topic. How do we translate is the word, which means moving in the commonly used phrase from the bench into the bedside. Dr. Mike Murphy in particular is going to talk with you today about some of that effort, which has led the way in the translational aspect of vascular biology that we think is very exciting. And all of this, of course, is directed to the goal. The final goal is really patient benefits and more ability to keep the process running like a circle. Speaking of circles, this is a picture many of you I think have seen as well. These are the participating center disciplines. From the outset of the center, the first retreat that we had, and going forward, we were able to start with a group of individuals within IU and some within Purdue as well. Being the IU PUI campus, we jointly share those. We even have some people who joined us from Notre Dame and Rose-Hulman, other institutions locally. But the center was comprised by investigators that were already here. Pre-existing disciplines, biological and physical on the basic sciences side, and then in the clinical sciences, both medicine and many other specialties. The center organization is located within cardiology because I'm a cardiologist, and within medicine because cardiology is within medicine. But it really embraces all of these different areas. Every one of these specialties noted had at least one or more investigators in there. And so this was the start. Since then, we've had the opportunity to participate in recruitment in a number of areas, and I've circled here the recruitments that we've made over the years. Now, I think it's important to point out that not all of those recruitments were necessarily contributed to in a substantial way from a cash perspective. But what we've been able to do is create an environment that is, I think, known in many places, maybe around the country, for collaboration and being a good place to work together. And that is really the culture of the medical center as a whole. So that is certainly, I think, a well-known feature of IU and the medical center. We have that within the vascular piece of that. And that has brought people from other disciplines to want to join us, even when we don't necessarily have specifically, for example, additional monies to contribute to the recruitment. It's a partnership with many of these other departments. And in some cases, we have been able to contribute substantially as well. I add here in light blue some places else on campus that we've had the opportunity to train people and then have those people go on campus. And I'll talk a little bit later about who are going elsewhere off campus, of which there are quite a number, and that's very standard for a research organization of this kind. Our goals from the outset, so we've talked through several of these: maintain a collaborative environment, recruit faculty, provide key support staff, that's very important, pilot research funding for pilot research programs. In other words, the notion here is we would like to have the ability to internally fund research as much as possible to do ideas that are still high risk, because many of those high risk ideas will turn out to be high reward as well. And so often that is funded internally to an organization. And this is an important role that your funding continues to play to allow us to do that every now and then. And of course, doing that more often is one of our important goals. Providing required equipment, educational initiatives. I'll talk about our training grant in just a bit. That was a federal grant that we were able to obtain as a vascular biology center, again, really based on the original vision. And we obtained that 3 years ago, and I'll tell you about how that's going. Translational and business initiatives is an important goal. In our economy, as I think many of you would be aware, it is really not easy to get new devices or new drugs or other things of that nature that are discovered into patients without having something we call technology transfer, which means typically getting a patent, doing a license, or creating a startup company, things of that kind. And so we recognize the importance of intentionally creating an atmosphere and environment where we recognize we want to push those things forward. And we've done that from the outset, in many cases, I think, thankfully, somewhat successfully. All of this to help advance investigation and translation and then attract new funding again, so the cycle continues. So here are some of our accomplishments. I'll talk a little bit more about each one of these after showing this overview slide, and then we'll have the speakers elaborate on several of them. So I think we are recognized now as a strong center of vascular research with a very favorable environment at the national level. It's really a blessing to hear people come through and not infrequently make comments about how that's really working well here. I was just telling Dr. Chen and Dr. Crabb a little bit ago about a comment we heard from someone at the University of Pennsylvania, how it was the envy of many medical centers, he thought, how we're doing this translation from stem cell research of the vessels into patients. We've heard similar things from quite a few other visitors and also external advisors. I think the leading program that's emerged in the last several years in the Vascular Biology Center is really one of adult stem cell research. It turns out that the blood vessels are the location, the site that harbors many stem cells in the body, both the endothelial cells as well as other cells that are in the body. So that what's called the stromal cells, the ones that surround that. From that platform, the center has been privileged to have a national leadership position in patient trials of stem cell research, all again derived from your own body. So this is adult stem cells, not embryonic stem cells. It's an important distinction oftentimes. And this is being led by Dr. Michael Murphy, a surgeon, and I think many of you come to know him over the last couple of years as his trials have begun and then advanced, and he's going to describe where they are today. Pilot research program I just mentioned before, and I'll talk a little bit more because of Dr. Chen's vision to partner cardiology funding with that of with the initiatives of the Center of Vascular Biology. We also were able to gain additional campus funding. We'll talk a little bit about that new program that's an outgrowth of the Vascular Biology Center and Cardiology. ICVBM affiliated investigators have, at my count, and I may have missed even some here, but they've contributed to the formation of at least 6 startup companies. One of the most recent and active in that area has been Dr. Ghassan Kassab. I think you've known him for the last 2 years as well, and he'll talk to you some more today about how his development is going on. He is a person who was recruited as what's called the guidance chair in biomedical engineering with a vascular focus. We've also been able to attract faculty, partnering across departments in a continuing way. The most recent one, Dr. Carmela Evans Molina, you'll meet her later on today. This is interesting because she has a focus in diabetes, and so we're reaching out now into the area specifically of vascular biology and how it connects with diabetes, and I'll talk a bit about that too. Our training grant has been at capacity with 5 fellows for the last 2 years. That means that we at any given time are having 5 specific federal funded trainees. The most recent one to join that grant, Dr. Whitney Seals, will talk a bit about her anticipated research today. This training grant now has 3 graduates. 2 of them have obtained their own funding, so that is what we consider very successful. As I mentioned, the leading program in adult stem cell research, I won't take long on this slide. There are the cells that line the vessel wall, called endothelial cells. There are cells that are derived from fat, or also known as adipose tissue, and cells from the bone marrow, which really are important in creating blood tissue. These are a lot of names. The point is that there are quite a few people on campus which are integrally involved in these programs and the Vascular Biology Center. That led us, in one of many different instances of things that could happen, there was a very good meeting that occurred in Indianapolis last October. This is just a press release about this topic. IFATS was the title of the meeting, which is the organization, actually, it's International Federation of Adipose Therapeutics and Science. And last year I had the privilege to be the president of that organization. This year the president is in France, so the meeting will be held in France. But last year we had it ended up being actually more than this. We were near 200 people from around the world came to Indianapolis to hear about and to discuss their various areas in this research. And we hosted them because we've become a leader in that area of research, again, thanks to a lot of what's going on with your support and with the Vascular Biology Center. This just shows a bit about that meeting. The attendees have grown over the years. That was the 5th year of that meeting, and the number of abstracts that have been presented at that meeting. So that just shows the growth of that as an activity. This is actually a letter that I showed you last year, and I'm showing it again just because, again, the audience is larger. The point being that, this favorable environment, I think, is very positive. This is a letter I received from the co-director of a similar center in North Carolina. And he said, I want to thank you for the visit. I was impressed by the high quality, the cooperative interactions among the research scientists. Common interests became evident. As a result, I now have collaborative experiments with 3 different people in the center. That's remarkable and reflects very well on our interactivity.